Hi, my name is Dr. Caroline Guerrero Calqui, and I am the chair of the Fellowship Committee for the International Academy of Orthokeratology, as well as the Section Fellowship Chair for the American Academy. What I'd like to do in this video is help you understand how to send in an application to become a Fellow of the Academy, what steps you need to take. So, hang on, and here we go. What are the requirements to submit an application? First of all, you have to be a continuous member of the FIAO for at least 2 years, have attended a section meeting within the last 3 years, just one of them. You've attended Ortho-K boot camp, and you've fit 50 Ortho-K myopia control patients, but 40 of them have to be at least Ortho-K. Now, if you have fit over 100 Ortho-K patients, we figure you know what you're doing and you've been around for a while, and so you really don't have to take the boot camp. That can be waived if, in fact, you fit more than 100 patients. And you have to either be able to fit a fully modifiable software-designed lens or fit a minimum of 2 different types of manufacturers. You have to use a topographer and know how to use it. And then, of course, if you are a member of the FIAO, you have to hold the rank of senior FIAO. So let me take a moment to explain to you why it would be a great idea to start this journey. Well, first of all, it's a practice builder. When patients look on the website looking for a doctor who fits Ortho-K molds, then they see your name prominently displayed with a little red tag by it saying you are a Fellow of the Academy, and the description of the Fellow indicates that the person is an expert in fitting and they've gone through extensive testing. Also, of course, the studying process increases your knowledge, which is a great thing because you're thinking you know everything about Ortho-K, but when you're actually forced to study it in detail, you find out you don't know quite as much as you thought you did, and your knowledge gets expanded, which of course is great for fitting contact lenses and for troubleshooting in a much more effective way. Also, you're viewed as an expert by your patients, an expert by your staff, and that of course increases the fact that people might choose you to fit their lenses over others. You have that crazy FIAO attached to your name, and that is a conversation starter because the patients will ask your staff, well, what does that mean? And the staff can then, if you have properly trained them, go on and brag about your credentials and how you're a fellow and how you're an expert, and that's always very, very good for you. And then, of course, finally, the transfer of care. When one of your colleagues refers your patient into their patient into your area because they're relocating, they're going to go on the website and look for a doctor in the area, and if they see this red tag Fellow, they'll probably choose you because you are viewed as an expert. It will do a better job of transitioning care for the patients. So I hope I've showed you how the FIAO can actually be a wonderful value-added advantage to your practice. So what are the skills necessary to apply for and attain a fellowship in the Academy? Well, first of all, you have to be an absolute expert in the design of an Ortho-K lens. That means you have to know the function of every single curve on a multi-curve lens. What do those curves do? How are they manipulated to make a change in the fitting? How are they manipulated to make the lens fit better in the very beginning? If your lens of choice doesn't allow alteration, then you have to know how to manipulate those curves on a theoretical basis. So we might give you a lens design and say, hey, tell us how you might fix this particular fit exactly by manipulating a particular, let's say the alignment curve. And you are going to be obligated to be able to describe that, even though in the way you fit the lenses, that's not done. You have to have a comprehensive knowledge of topography. That means every single type of map that's available in any kind of topographer that might be out there, and why you would choose a particular map for decision making, especially in pre-fit analysis and then again post-fit analysis to see what your treatment effect has been, and then in troubleshooting, how you use the topographic maps to determine where you go in terms of the fitting. And what do all these data mean? It'd be able to explain that really in extreme detail because we're going to ask you. And of course, Remember we talked about earlier that you have to be able to either fit 2 ortho-K manufacturers or one that's fully modifiable. And the reason we say that is because you can't just expect to be an expert and fit only one lens, have knowledge of only one manufacturer. You've got to have a little bit of breadth of knowledge here. And if you're fitting one that's fully modifiable, then that is a full breadth of knowledge. So just either do 2 of them or do a fully modifiable lens. And we don't care whose companies you fit. We just have to have the knowledge there. Troubleshooting. Well, of course, you have to be able to identify the cause of the problem, and then you have to be able to explain how you would manipulate all the curves and why you would do it in order to fix that problem. Recognize complications, and it would be nice to be able to recognize them before, but of course we can't always do that. But what are the causes? What caused that particular complication to happen in theory, and then how are you going to fix that? And of course, use of the sodium fluorescein patterns in diagnosis and also in fitting. This is going to be a very important part of the exam, so you have to be able to be an expert in this sort of analysis. Complex designs. What you have to do is show us that you have a great deal of advanced experience in fitting ortho-K designs. And they can't just be simple designs, because that doesn't show your skills as an advanced orthokeratologist. We've listed a bunch of different types of cases that might qualify as challenging or interesting. You can't just do a high myopic slam dunk case. It doesn't work that way. We have to know that you have identified some serious, interesting challenges pre-fit, or that you've had challenges during the fit. Show us your skills. Don't just make it easy, because those don't qualify. So here is a brief summary of the steps that you would take in the testing protocol. What are the steps for submitting an application? Well, first you have to request an application from your section fellowship chair, and the names are listed here currently. If your section doesn't have a chair, or you don't belong to a defined section yet, and some of the places in the world don't have a section at this point, then contact me and we'll make arrangements to get you tested in one of the particular sections that's giving a testing exam in the next coming months. Now, make sure when you fill that application out that it's filled out completely, because it's quite long and extensive, and it helps us to understand your qualifications and who you are. But before you submit it, make sure that you do meet the qualifying requirements, because that's very, very important. Now, if you are chosen, you'll be contacted by your section fellowship chair, and this is where your study preparation begins. If you aren't chosen, you've got to realize there are only so many testing spots in the academy, and so your section fellowship chair will contact you and explain why. But sometimes it's just a matter of the fact that we don't have enough testing spots open, and there's nothing wrong with your qualifications. We just don't have enough spots open. And of course, you can apply next year, no problem. We will ask you to study and prepare yourself extensively for the written and the oral panel exam. You'll do that with a list of books and articles that we'll provide you, as well as a video study guide listing all of the different items that will be covered on the written exam. And then also we'll provide you with access to a mentor reviewer who can answer some of your incidental questions. So you've spent the last couple of months preparing, and now it's time for exam day. And exam day starts with a 5-hour advanced review, and it's given just prior to the written exam, which will be given later in the afternoon, and the attendance is mandatory. But you'd be crazy not to want to attend it, because it is an excellent review, and in fact a lot of fellows attend this just to get brushed up on different concepts about ortho-K. It's a wonderful exchange. It's fairly small, and it is really very, very valuable. It will seal in a lot of your knowledge. What do they cover? Well, they cover lens structure and design in detail, troubleshooting using a a theoretical lens and then going through every single curve and what the curves do and how they make changes in the treatment, and also advanced fitting techniques. And you're going to get a lot of invaluable pearls from this, but more importantly, it really gives you a nice closure on your studying so that when you go take the test, you feel like, you know what, I have a good command of this now. It's all making sense. We come to the multiple choice test. That is a series of multiple choice questions that cover all of these different topics right here. It's very extensive, and you must pass with an 85% based on a curve, and if you do, then you will immediately go into your oral panel exam. The oral panel exam. Well, let's hope you have something more to say than just wave at everybody, because this is a very, very important part of the testing process. The case presentation is the first part of the oral exam. This is a very, very important part of the entire process. You are going to be presenting the 2 cases that you submitted. You have about 10 minutes, and you need to show the panel that you know what you're doing and that you are an expert. They'll be giving you lots of questions about your particular cases, so be very, very well prepared and show them that you are a fellowship quality candidate. The second part of the oral panel exam is a section called the practical section. And what you will do is be viewing various maps and sodium fluorescein patterns, and then answering questions from the panel on what you see, what regards the treatment, the outcome, and analyzing the fluorescein pattern, all sorts of different questions, but on real cases. The panel will also give you a lens design and ask you how you might modify this lens design to better achieve myopia control. So if you pass both sections of the oral panel exam as well as the written exam, you have your fellowship. Yay! So there you have it. This is how you apply to become a fellow of the International Academy of Orthokeratology. Are you up for the challenge? Let's go for it.